Good day, everyone. So today, we will talk about speech and language disorders that result from hearing impairment. So the most devastating effect of deafness and other forms of hearing impairment is on language development. Persons who are deaf or hard of hearing manifest speech and language disorders as a, as a result of conductive sensorineural auditory nerve, central auditory nervous system, and functional hearing losses. So, central auditory is a condition in which the ears and the brain do not work well together. People with CAPD can hear, but the brain has trouble processing the sounds. They have trouble telling the difference among similar sounds and words. Speech and language disorders. Deafness restricts the perception of the sound elements of a language and other sounds in the environment with or without hearing aid. While deaf persons can develop their communication skills manually through sign language and arbitrary gestures and movements, or orally through speech, reading, and auditory training, these adaptations cannot approximate normal speech and language development. So, there are four types of hearing loss. The first one is conductive hearing loss. This is caused by something that stops sounds from getting through the outer or middle ear. This type of hearing loss can often be treated with medicine or surgery. The second one is sensorineural hearing loss. Hearing loss that occurs when there is a problem in the way the inner ear or hearing nerve works. The third one is mixed hearing loss. Hearing loss that includes both a conductive and a sensorineural hearing loss. So the fourth one, auditory nervous system. Hearing loss that occurs when sound enters the ear normally, but because of damage to the inner ear or the hearing nerve, sound isn't organized in a way that the brain can understand. Etiology of speech and language disorders. The causes of speech and language disorders are complex. There can be functional like environmental stress and can also be organic in the case of cleft palate. The causes can be congenital when the disorder is present at birth, or they can be adventitious or acquired after birth, in infancy, in early childhood, and in the latter years. Etiological factors are traced to brain damage is an injury that causes the destruction of brain cells. Secondary to mental retardation is present in about 2 to 3% of the population. It can be defined as cognitive ability that is markedly below average level and a decreased ability to adapt to one's environment. ADHD is one of the most common neurodevelopmental disorders of childhood. Learning disabilities are disorders that affect the ability to understand or use spoken or written language, do mathematical calculations, coordinate movements, or direct attention. Autism refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. Schizophrenia is a mental disorder characterized by disruptions in thought processes, perceptions, emotional responsiveness, and social interactions. Cerebral palsy is a group of disorders that affects a person's ability to move and maintain balance in posture. Cleft palate. A cleft palate happens if the tissue that makes up the roof of the mouth does not join together completely during pregnancy. Vocal and cord injury occurs when the nerve impulses to your voice box are disrupted. Gilles de la Tourette syndrome is a neuropsychiatric movement disorder which has onset in childhood. Diseases and trauma are a group of emotional and behavioral problems that may result from childhood traumatic and stressful experiences. Meningitis is an inflammation of the protective membranes covering the brain and spinal cord. Incidence and prevalence. Language and speech disorder is a high incidence disorder. There is a strong relationship between communication disorders and learning disabilities, and the primary disability should be identified. So when we say a communication disorders, is an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal, and graphic symbol systems. So, learning disabilities or learning disorders are umbrella terms for a wide variety of learning problems. a learning disability is not a problem with intelligence or motivation, and kids with learning disabilities aren't lazy or dumb. In fact, most are just as smart as everyone else. Their brains are simply wired differently, and this difference affects how they receive and process information. Learning and behavior characteristics. Children with speech and language disorders have problems in receptive and expressive language. So when we say receptive and expressive language, an expressive language disorder is one in which the child struggles to get their meaning or messages across to other people. A receptive language disorder is one in which a child struggles to understand and process the messages and information they receive from others. Children with receptive language deficits. Children with receptive language deficits have difficulty in communicating their ideas, as shown in the inability to express or verbalize their thoughts, respond to questions, retain and retrieve or recall information, and difficulties in activities that require abstraction. The areas of deficit in expressive language includes difficulties in grammar, syntax, fluency, and vocabulary. Delays in language development. Delays in language development show when the child is behind his or her peers in the acquisition of speech and language skills. Speech and language disorders are secondary to disabilities such as ADHD, learning disabilities, autism, schizophrenia, cerebral palsy, cleft palate, and other disorders of the palate, vocal cord injury, and the Gila-Tourette syndrome. Speech and language disorders negatively affect cognitive functioning, low academic performances as a result of concomitant difficulties in organizing ideas, following directions, recognizing phonemes, producing sounds, and finding the right words for things. Social interaction, reluctant to participate in school activities, and attentive, reluctant to interact with peers. Behavior, perceived exclusion or rejection, feeling of frustration, withdrew from social groups. So, assessment procedures. The following steps are prescribed by the Social Education Division, Bureau of Elementary Education of the Department of Education. So, we have here pre-referral intervention. So, what is pre-referral intervention? So, is to identify, develop, and implement alternative education strategies for students who have recognized problems in the classroom before the student is referred to special education. So, the second one, the multi-factored evaluation, is a screening tool intended to gather information on learner strengths, needs, learning styles, and other educational concerns. Pre-referral intervention. Teachers in regular class, parents, classmates, and other people who communicate with the child regularly report the student who is suspected to have speech and language disorders to the school principal. The special education teacher conducts the screening process by using a checklist of characteristics of children with speech and language disorders, by observing the child's communication skills in formal and classroom setting, and informally at home, in the playground, canteen, and similar places. The pupil and the parents or caregivers are interviewed to validate the results of the nomination form and checklist. The findings are compared to the normal characteristics of speech and language development indicated in the milestone on language development to determine delays tentatively. Multi-factored evaluation, by comparing the child's receptive and expressive language levels to his or her mental age, differentiation between a language problem and a development delay can be made. Formal evaluation by a speech pathologist is arranged. Some widely used speech and language tests in the United States are the Peabody Picture Vocabulary Test. This is designed to measure the receptive vocabulary of English-speaking adults and children. So, auditory comprehension of language. In this chapter, listening comprehension is defined as one's ability to comprehend spoken language at the discourse level, including conversations, stories, narratives, and informational oral text. That involves the processes of extracting and constructing meaning. Boehm test of basic concepts. The Boehm test of basic concepts Third edition is a comprehensive assessment for children grades K-2 that contains 50 basic concepts. Comprehensive Receptive and Expressive Vocabulary Test. The Comprehensive Receptive and Expressive Vocabulary Test, third edition, is an innovative, efficient measure of both receptive and expressive oral vocabulary. Kaufman's test on early academic and language skills. It is a valuable tool for testing school readiness, identifying gifted children, evaluating program effectiveness, and researching children's early development. Educational programs. The American Speech, Language, Hearing Association offers some suggestions for the regular teacher in an inclusive class and for the special education teacher as well. First, introduce changes in the home and school setting, especially if the child has central auditory processing problems. To help the child focus and maintain attention, give him or her a seat that is away from the auditory and visual distractions. A seat close to the teacher and in the blackboard and away from the window or door may be helpful. Second, reduce external visual and auditory distractions. A large display of posters or cluttered bulletin boards can be distracting. Provide the child with a study carrel. Earplugs may be useful to block distracting noises. Check with an audiologist to find out if the earplugs are appropriate and which kind to use. Use visual aids and write obstructions to supplement spoken information. Emphasize keywords when speaking or writing, especially when presenting new information. Preliminary instruction with emphasis on the main ideas to be presented may be effective. Use gestures that clarify information. Vary loudness to increase attention. Review previously learned material. Recognize periods of fatigue and give breaks as necessary. Avoid showing frustrations when the child misunderstands a message. Avoid asking the child to listen and write at the same time. For children with severe central auditory processing problems, ask a buddy to take notes or ask the teacher to provide notes. Tape recording classes is another effective strategy. That's all for my today's topic. I hope you learn a lot. Thank you and God bless.